Hey there, good morning. So today we're going to talk about surgeries. So most of you know, myself being a yoga teacher and a physical therapist, I try to avoid surgery whenever possible, but sometimes it's just a necessary thing. That's the beauty of our society right now, is that we have Western medicine available to us, and it's a wealth of information and can save lives. So sometimes surgery is the best option. And ironically, even though I always try to go for the more natural solution to things, I've ended up having to have 5 different types of surgeries, and 3 of them are more from orthopedic issues from when I was back a springboard diver, and I was a little kamikaze, and essentially in my early 20s, my late teens, and I thought I was invincible. And I returned from surgery too early, or returned back to practice too early following a surgery, which led to another injury. So I've had some experience with orthopedic surgeries, and then as well as I had my cesarean, and now this more recent colon surgery. So, I receive a lot of questions regarding surgery, and looking back through my experiences with surgery, and especially following this surgery, I'm realizing that, there's a gap. There's a huge gap from what the surgeons tell us and sometimes what we experience, and even just knowledge and support and that sort of information. So my goal is to help answer questions and better prepare yourself, or if you have a loved one going through surgery, or a friend, because there's things you can do leading up to surgery, there's things you can do the day of surgery, and there's things you can do following surgery that'll help enhance or sorry, I'm just looking at comments. There are things you can do to enhance your rehab and rehabilitation. So surgeons, they do a really wonderful job. Like, there's all these minimally invasive procedures out there that lower recovery time, that lower hospital stay, which reduce your risks. Most surgeons are really proficient and passionate about their work. I did work in a PT clinic years ago where I did run across some surgeries that weren't so good, but I think that's the rare incident. I think most of the times the surgeons and their work are really good. So what happens? What goes wrong? Why do I see all these patients that have all these questions, or maybe they're doubting their rehabilitation, or they're still sore even though the surgeon says they should be fine? Like, what happens then? So in my own experience, I feel that with the surgeon, they tell you they're pretty liberal in terms of the amount of time it takes to heal. A lot of the times, symptoms that'll be experienced, and return to activity. And I think that's only because a lot of the surgeons haven't experienced surgery themselves. Or if they had, it's not the surgery that they're performing on people. So really they haven't gone through it themselves to really understand what a patient goes through on a day-to-day experience when recovering from surgery. So for example, coming back from this surgery, it's a fairly simple procedure, and it is a minimally invasive procedure that I went through. So the surgeon was pretty liberal in terms of my guidelines for returning back to work and normal activities and such. But given what I am, a physical therapist and yoga teacher, right, I loosely interpreted what he said, because he was not very structured in the guidelines that he told me. He was like, oh yeah, you'll be fine, you know, just, you know, he's very loose in what he told me. And so I started back to activities and work way too early. And you know what I ended up doing was making myself more sore and having more symptoms. I felt worse last week than I did right out of surgery, which is not normal, right? And then when I saw the surgeon, he looked at the surgical site and it was all fine. I'm healing normally. And he told me, you know, well, your symptoms have nothing to do with your surgery, which is true. My surgery did not directly cause the symptoms that I was feeling. However, there is a connection, and I think that's what happens right now in our society, is that a patient goes and has surgery. There's no prep. There's no like mental preparation or physical preparation. They just have this surgery, and then they're sent out with very little follow-up, very little instructions, a piece of paper they probably throw away or lose because, you know, most likely they're sedated or had anesthesia. I mean, this piece of paper is like the least of their worries, and then they don't follow up with the surgeon till, you know, maybe sometimes a few weeks after. And or you know, they're supposed to start physical therapy like right away. It would be in the best interest of the surgeon, and it'd be in the best interest of the patient to start physical therapy really soon. And I'm not talking about aggressive physical therapy where they're doing exercises or strength building. I'm just talking about gentle mobility or instructions or guidance, because that's going to improve the outcome, which is going to make the surgeon look better. And the patient obviously is going to feel a ton better. But instead what's happening is the patient's getting home, then they're waiting a couple days to call their insurance, or they try to schedule with physical therapy and they're like, oh, we need authorization. That's another week to 2 weeks, you know, 10 days or so, until they can actually call the physical therapist office with their authorization. And then finally, by the time they get scheduled, it's like 3, maybe 4 weeks out, when really they should have been in the office that very first week. So anyways, my goal now is, you know, going through this surgery again, it was a reminder of the importance of having a support system for people going through surgery. So common questions I get asked are, you know, what can I do to prepare for surgery? So the better your state of mind going into surgery, the better the outcome. So that means how you feel, right? Your belief, your confidence in yourself that you can heal, your belief, your confidence in the surgeon, your team, the hospital, all that will impact how you heal. So going in with a really positive mindset, it sounds maybe out there or intuitive or fluffy, but research really supports that your belief in all this will really impact your outcome mentally. So physically, the stronger you are going into a surgery, the more mobile you are going into a surgery, then the easier your rehab will be. Just because you will lose strength from a surgery, it's just natural. So if you have a lot of strength to begin with, then you lose some. You're still able to move in bed. You still have some arm strength to help you, get in and out of the bed, go to the bathroom. That sort of normal stuff that we take for granted is really put to the test. So the more mobile, the stronger you are going into surgery, then the better the outcome. So the more that you can prepare yourself for this and get a team of people to help you when you come out of surgery, then again, the better your outcome. So sometimes that means staying in good communication with your surgeon, even if they might not be the best communicator. Just forcing it out of them, knowing what questions to ask your surgeon, like, can I specifically do this? When can I return back to lifting my kid? When can I return back to walking my dogs? specifically what muscles were cut, what were just moved aside, what structures did you go through, what fascia was impacted. All this kinds of stuff will impact, you know, how you feel coming out of surgery and how long it'll take to recover. So like a rotator cuff surgery, you know, you're going to have 6 to 8 weeks of no mobility, like especially if they repair the supraspinatus or the infraspinatus and those muscles are reattached, you cannot move your arm at all actively for at least 6 to 8 weeks. And then it's a very strict, regimented procedure to returning back to that. And I unfortunately used to see a lot of patients that would really do damage to their surgery because they didn't quite understand that they couldn't use their arm, and they would go to use it and that suture that was holding their muscle together pops and lets go. So you know, understanding your discharge instructions are super important. So as a physical therapist, you know, what I help to try to provide for patients coming out of surgery is not only what they need to do physically, whether it be rest, whether it be gentle movement. I help with that, you know, reducing scar tissue adhesions. So that's another thing, like with my surgery, it's not only the surgery that has scar tissue adhesions, and the colon is right in front of the spine, so that it even affects how my nerves feel, and I have to get everything in there moving again. But it was all the procedures for me leading up to the surgery that started the whole fascia bound down process, because some people, like myself, I'm a keloid scar healer, so you can probably see my thick scar here, and that this scar is maybe like 15 years old, and so it moves now and is pretty flat. But if you can imagine this for my cesarean, which is still really rigid and firm and thick, and if that area is bound down, it's going to affect how your organs work. It's going to affect your joints. It's going to affect the interplay from all the structures above, across, below. And some surgeons are very good, and they believe in that, and the whole, you know, Tom Myers fascia train and all that kind of stuff. So they'll try to get you into PT to get the fascia moving. But some surgeons, like my surgeon right now, he's very good, doesn't believe in that. However, you know, I know my nerve symptoms are affected to my scar tissue being bound down, so I'm going to go see someone and get it worked done. But a lot of patients don't know that. I just, you know, have the luxury of having this information at my disposal only because I went to PT school, and I continue with my Con Ed classes, so I stay up to date on this kind of stuff. But if you're not in the system of knowing this, then you would just think that that's normal. It was normal to not have limited motion, for, you know, your digestive system to change, for example, following a spinal surgery. That's not normal. To have these lingering symptoms that a surgeon, he might know or she might know in a year's worth of time, 2 years worth of time, that might all change and you might be fine. But the patient doesn't know. And a surgeon's very reluctant a lot of the times to say, hey, it's going to take a year. It's going to take 2 to fully rehab. And truthfully, that's the norm, like a year or 2. So anyways, there's a lot of gaps in what a surgeon may say, which is, you know, they try to do their best, but really what a patient experiences and what they go through coming out of surgery, especially all the trauma the body's put through, the emotional stuff that sometimes gets trapped in the nervous system from a surgery when we're unconscious or not, you know, or sedated or whatever. How is that let go? Just being in the hospital and maybe running into contact with other germs and such, and running the risk for infection. How do you prevent that? You know, if you have a cesarean and have another kid, how do you carry how do you care for these 2 kids during that 6 weeks of time when you can't lift, you can't really use your abs? How do you support yourself then, and not run the risk of opening your sutures? All this sorts of stuff are questions I commonly get asked. So if you have any specific questions regarding surgery, then you can comment below. If you've had a surgery that had delayed healing, then you can comment below and talk about it. Or if you have any questions on the best way to heal and recover from surgery, then you can comment below. Otherwise, I'm going to sign off soon here. And you know, if you have any topics or suggestions for the next week, then just let me know. But if you are going through a surgery or do know someone that has an upcoming surgery, don't hesitate to reach out to me. I just put together a new surgical care package for people to help prepare for surgery and then rehabilitate, so they can rehabilitate to the fullest and then, you know, feel as if that their outcomes are, you know, whether the surgery was chosen, whether it was elective surgery, or whether it was a surgery that, you know, there was no choice, that had to be done, but that they can go back to living their lives the fullest, because it really is possible. Sometimes, though, we get stuck in this healing process following surgery only because there's just not that great of communication between the surgeon and the patient's kind of wondering, like, what's going on here? And then they start to doubt, or they get back to activity too soon and all that sorts of stuff, and it really delays the healing. So if you have any comments or questions, just write them below and I'll follow up. Or if you have any topic suggestions for next week, leave them, and again, I'll follow up. But yeah, that's a little bit of what I'm working on right now. So I hope you guys have a great day, and we'll just talk soon. Bye.